Good afternoon. My name is Mia Gutridge. I am the chapter president of the Grand Rapids Alumni Chapter of Delta Sigma Theta Sorority Incorporated. COVID-19 has affected all of us to make a shift in our normal lives. It came upon us in 2019 and it is in 2020, and it is still here with us 3 years later. Today's Shades of Blackness event is to bring awareness of the impact COVID-19 has had on our community. We have an awesome panelist, and they will speak about their experience and point of view of how COVID-19 has impacted them as well as the community that they serve. We encourage you to ask questions by putting them in the chat, and we will make every effort to answer them while we are live. Now, I will introduce Sora Yatundi Rotimi, and she will give you a brief synopsis of the host committee, which is the International Awareness. Enjoy.
Thank you, Madam President. And good afternoon, guests. Just so you are aware, my name is Yatundi Rotimi on behalf of the International Awareness Committee as co-chair. We thank you for being here with us today, especially during Black History Month. As you heard prior to the start of our presentation today, you heard the music from Babatunde Oluntunji, a Nigerian drummer from the CD Drums of Passion. The song, which is entitled Jingo La Ba, which means do not worry, which is very befitting for today's program when we are speaking about COVID-19. And you will hear from our panelists in terms of do not worry, which means we are in this together, so we do not have to worry because it's all in God's hands. So I just want to share with you a little bit about who the International Awareness Committee is and the connection to Black History Month with the music that you heard. Babatunde Oluntunji was the first African to bring drumming to the United States. With us as an International Awareness Committee and who we are as a national organization through Delta Sigma Theta Sorority Incorporated, have a far reach, not just here locally within the Grand Rapids community, but far reaching through the Caribbean, through Asia, and also through
Today's Shades of Blackness event is to bring awareness.
Reaching through the Caribbean, through Asia, and also. And just so everyone is aware, the International Awareness Committee is actively involved here in the Grand Rapids Alumni Chapter in establishing initiatives focusing on the African diaspora. And we have initiatives through the Mary Help of the Sick Mission Hospital, the Charette School in Haiti, among other initiatives. As well, we have collaborations with the Grand Rapids Rotary, where we collected books that were shipped to Ghana, and a chapter which currently is still doing this through a sew-a-thon for dresses for local Haiti children during the hurricane season. As a national organization, we do have a far reach as well, where we have over 1,000 members in collegiate and alumni chapters. And our chapters spread throughout the United States, Canada, Japan, Tokyo, and Okinawa, Germany, the Virgin Islands, Bermuda, the Bahamas, Jamaica, West Africa, the Republic of Korea, and also South Africa. So today, we invite you to be here with us for the candid conversation about COVID in our communities, and to be able to understand who we are as a far-reaching organization. And now I will take it over to our soror, Valissa Armstead, who will be speaking about Heart Association and our collaboration.
So good afternoon. My name is Valisa Armstead, and I am the Physical and Mental Health Committee Chair for our local chapter of Delta Sigma Theta Sorority Incorporated. And today's event is also a key tie to one of our nonprofit charitable partners, the American Heart Association. Our goal with having national partnerships like American Heart Association is to support important domestic and global concerns like COVID-19 in order to remove barriers by addressing disparities within communities of color, particularly those facing our African-American brothers and sisters. So as we host today's Shades of Blackness, talking COVID-19 in communities of color, I would like to introduce our moderator for today, Ms. Vanessa Green, the CEO of the Grand Rapids African American Health Institute.
Thank you, Sora Valisa, and good afternoon to everyone. As Valisa indicated, my name is Vanessa Green, and I am the Chief Executive Officer of the Grand Rapids African American Health Institute, and I'm also a proud member of the Grand Rapids Alumni Chapter of Delta Sigma Theta Sorority Incorporated. And so it is my honor to moderate this panel discussion today entitled Shades of Black, a discussion about COVID in our community. First of all, I'd like to thank our president, Madam Mia Guthridge, as well as the planning committee. And I'd like to thank each of you, our virtual audience, for being here today with us. I'd also like to thank our esteemed panelists for the expertise they bring to our community as they highlight the impact COVID-19 has had and continues to have on our community, especially among our youth and older populations, as well as they will also offer ongoing solutions and resources available to our community. And so first of all, we will have Dr. Lisa Lowry. Dr. Lisa Lowry is the chief or the section chief of adolescents and young adult medicine at Helen DeVos Children's Hospital at Spectrum Health, as well as the Assistant Dean for Diversity and Cultural Initiatives at Michigan State College of Human Medicine. Dr. Lowry, can you introduce yourself to us, please?
Good afternoon, and thank you. Yes, as Section Chief of Adolescent Medicine at Helen DeVos Children's Hospital Spectrum Health, we have a multidisciplinary practice that provides both subspecialty and primary care to teenagers and young adults. We are also the home of our undocumented minors and work collaboratively with several agencies in our community. So we provide care from everything from reproductive health care, treatment for sexually transmitted infections, eating disorders, and of course, mental health. I've also had the pleasure since April of 2020 serving as Assistant Dean for Diversity and Cultural Initiatives at Michigan State's College of Human Medicine. Specifically here in Grand Rapids, we are the home to over 300 medical students for the College of Human Medicine, as well as almost 400 residents. So we are a central hub here in Grand Rapids. And my role, a newly created role, was actually to improve not only the cultural competency of our faculty at CHM, but also to overall improve the learning environment for our residents and medical students. So I look forward to serving on the panel. Thank you.
Thank you, Dr. Lowry. And Dr. Lowry is one of the busiest people that I know, and she is always willing to show up and to share and to support our community. So thank you so much, Dr. Lowry. Next, we will have Ms. Kenyatta Hill, who is another superstar in the community, and she is the principal of the Grand Rapids University Preparatory Academy at Grand Rapids Public Schools. Ms. Kenyatta, can you please introduce yourself?
Yes, thank you so much. Good afternoon, everyone. I'm so excited to be a part of this panel with a great group of panelists today. Like Vanessa said, I am Kenyatta Hill Hall, the principal of Grand Rapids University Preparatory Academy, a Center of Innovation program, one of the first of Grand Rapids Public Schools. I have had 16 years of service dedicated to Grand Rapids public schools and various capacities as an elementary teacher, middle school teacher, assistant principal, and currently the middle school, high school principal. So that's a 6 through 12. So very excited to be a part of here today.
Thank you so much, Ms. Hill Hall. Next, we have Mr. Lee Moyer, who is the Director of Community Programs at Spectrum Health, Healthier Communities. So glad to have you here, Mr. Moyer. Can you please introduce yourself?
Yes, thank you, Vanessa, and thank you to the lovely ladies of the Grand Rapids Alumni Chapter of Delta Sigma Theta Sorority Incorporated. My name is Lee Moyer, and I bring you all greetings on behalf of healthier communities within Spectrum Health, as well as the Omega Psi Phi Fraternity Incorporated Iota Pi Chapter. Really excited to be here showing some Coleman love along with my sisters in Delta Sigma Theta sorority. So I have the privilege and the honor to serve on the philanthropic side of our hospital system with healthier communities. And I serve our maternal infant health program, as well as our prenatal education program, our Strong Beginnings program, and our school health program. So we have programming from, how we like to say, from birth to our extended lifetime. And we love to be able to be out in the community and serve those individuals as well. And love to be able to partner around giving back to community partners through, not only through philanthropic principles, but being able to provide health care to those in our community who look like us. So thank you once again for allowing me to be here and serving alongside my esteemed panel of professionals. Thank you.
Thank you, Mr. Moyer, and having had an opportunity to work with you, not only through your work with Spectrum Health, but also as a brother of Omega Psi Phi. Just love the way you always show up and care for the community. So you do great work. So thank you. And I'm looking forward to all that you have to share with us this afternoon. Last but not least, we have a young star among us, Ms. Audrey Robinson, who is a member of the Grand Rapids Alumni Chapter Delta Gems, growing and empowering myself successfully. So Ms. Robinson, can you introduce yourself, please?
Yes, hello everyone. My name is Audrey Robinson. I am currently a freshman at West Michigan Aviation Academy. I recently made the CEO list at my school for obtaining a 4.2 GPA, and thank you. I will be eventually taking various AP and honors classes, such as AP US History and Intro to Biomed, and I am just thankful to be here.
Well, thank you, and thank each of you. So we're excited to hear from you, and congratulations, Ms. Robinson, and yeah, just keep on shining. And we're just looking forward to where your career and your excellence will take you. So thank you again for being here. So we're going to move on now to each of the panelists. This question will be for each of you. And so in order for the audience to better understand who you are and why this conversation is important to you, I'd like to start off by asking each of you, how has COVID personally impacted you? And I'll start with Ms. Hill Hall.
Thank you. So, like many others, there has been some major life changes due to COVID. And so I'm going to go all the way back into March, when I first felt the impact, when I was preparing as a principal for conferences, getting our school ready for the parents and to welcome the parents into the school. And we got an immediate shut down the school, and pack everything up, no evening activities. And that was my first impact personally with COVID. I thought, my naiveness thought that it was going to be a 2-week shutdown, cleanup, and that we would be returning. But that was not the case. We stayed out of school, and for Grand Rapids Public School, did not return back in person until the following school year in January. So we went from March of 2019 and then returned to January 2020. 2020. And even at that time, we were hybrid. So the first impact was our students not being able to get face-to-face instruction, and then changing our whole educational direction of how we gave instruction. We went from one-on-one, which was unseen of before, and we went to virtual. So learning about many different instructional platforms, from Zoom to Google Meet to Schoology. And so all of these new instructional terms became new to educators, to students, to parents. Now we were collaborating on a different level with parents now becoming sometimes the teachers along with the teachers. So it was a total different collaboration. It was different in how we gave instruction, how long the instructional day was. So that continued to be the new evolution of instruction and education. And that was really impactful. And then it wasn't until January when Grand Rapids Public School decided to go hybrid, where we had part of our students become on certain days and another group. So that way we can do contract tracing. And it went from mask, it went to so many other factors that I would like to say that I have a newfound respect for people in the health industry, because I learned a lot about ways to wash your hands, which when I was in elementary, I taught that, but for middle school and high school, I was again teaching about healthy lifestyle within the school partnering. So yes, that was a way that impacted me. And along with, I was preparing for a big wedding and had to reduce the size. So personally, on a personal level, I was one of the COVID brides that had to put a twist on my wedding. So.
Wow. Thank you so much for sharing. So next we will have Mr. Moyer.
Thank you. So I echo a lot of what Sister Kenyatta said. When that date hit in March, it just threw everyone in a tailspin. And for me, I am a father of three. I have
and then it wasn't until January when Grand Rapids Public School
and for me, I am a father of three. I have
and then it wasn't until January when Grand Rapids Public School and
for me, I am a father of three. I have
and then it wasn't until January when Grand Rapids.
Let me just say this, you guys, everybody who's listening, we appreciate your patience, but we understand the issues with technology, particularly when we have like such a great, powerful panel, and we have like really important information to share. So we're just going to rebuke the spirit of bad technology right now. But yeah, so you guys just keep on flowing with your information, and we're going to work through the technology, but it's all good. It happens all the time. So
absolutely. Well, that's actually what I was going to go into, and we were forced to live through technology. It was like, don't come in the office, start to go in and utilize this software application called Microsoft Teams and just do virtual meetings. So for us, it was extremely impactful. And then with the kiddos being home, like I said, I've got a 17-year-old, a 15-year-old, and an 8-year-old. And back then, taken for granted, I've got teaching everything that you all do, you teachers, a lot of kudos, because that in-home teaching was an extremely trying time. And then being able to know that my teenagers could actually reach out and they could have a friend base still through their mobile devices, but my youngest couldn't. And it was extremely hard for him. And then even when they started to have us advocate to wear a mask, for him to wear a mask was a challenge as well, because he's an active little guy. So that in and of itself was a complete challenge. We did have a member of our family get COVID. We had loved ones who didn't want to get the vaccine, and we were stressing about the importance of it. And then we also were extremely impacted. I mentioned the school health, working with school health, and then working in healthcare period. And I know Dr. Lowry can attest to it. Just seeing our clinical providers and our frontline staff who are working day in and day out and trying to be there to help support them. And at least from our standpoint, provide words of encouragement, because we couldn't imagine what they were going through and just the capacity that they had to endure when dealing with multiple patients coming in. That was a shock to us. And then just making that shift now. So now that we know that it's out here, we had a vaccination, the vaccine that's out here. How can we promote it? How can we push it back and forth from that manner and be able to make it so that it can reach everyone? I think that has been one of the most impactful things that I have worked with. And then just continuing to see the resiliency of our healthcare staff, our frontline providers, our teachers, everyone who is out here, our public servants who are working with people, be able to bounce back. So it's just been a trying time, a learning time, but a time of growth as well.
That's wonderful. Thank you so much. Ms. Robinson, how has it impacted you?
It totally has impacted my life. I remember when we first had to go home, I was like, it was like the start of spring break or the week before. And I was like, oh, okay, early spring break. And then it started to prolong and prolong. And I was like, oh, okay, it's getting serious. And then I remember my first time going virtual and the internet wouldn't work. And I just started crying because I thought I was going to fail. And my mom was like, it's okay, it's okay. And I just had to calm myself down. And the impact is so huge. And then it has challenged my learning experiences and my abilities to learn and going back and forth from home and from school. And then my social skills were totally toned down because I wasn't talking to anyone. And then going into freshman year of high school, didn't know anyone, new school. So I had to learn how to talk to people again. And then the positive thing about it is I've been home. So with my family and getting to know them, because before COVID, we didn't take the time to get to know each other. So now we have the time to get to know each other. So let's get to know each other. And it was a fun time, challenging, but fun.
Yeah, that's awesome. Thank you so much for sharing. Yeah, Dr. Lowry.
Wow, everything that the panelists, as they were speaking, I started actually changing my answer because I remember March 13th, Friday the 13th, is when we were told to pack up and change everything. And so I remember that Sunday being on meeting after meeting after meeting, because not only was I trying to address it from a clinical standpoint as a clinician, how are we going to deal with staff, but then what am I going to do with my residents and medical students? And it was just very interesting in how we bring people back to work. I remember during that time, my small practice, we actually consolidated. Someone thought it would be great and they moved us to a whole different, like across the street. And so the resiliency that Mr. Moyer talked about, the frontline workers, and people were like, thank you for your service. And I was like, no, I'm outpatient still. My colleagues, and to this day, my colleagues are still of dealing with this. I mean, we've seen this. So some of the resiliency that you all talked about, and also from another thing, seeing my staff, a lot of my staff have young children. And so it was kind of, how do we balance, so literally I actually said, hey, y'all, I can go into work a lot more often than you all, and I'll see the few patients we have, and you all can stay at home, because I didn't have, I don't have kids at home. And so that's kind of how we navigated and kind of split the work as a team. Going to virtual health. I remember literally one day we had to sit through and say, okay, this patient can come in, we can see that patient virtually. And we literally had a little code that we put through, but the providers were tasked to do that, and then setting that up. And so supporting staff. And then I started a new role, nothing like starting a new role, talking about diversity, equity, inclusion on April 4th. So I remember sitting with my boss, Dr. Lipscomb, and in January, we had this great format and planned out what I was going to do. And then April 1st, it was like all these Zoom meetings. And to this day, still people go, you still really haven't been oriented. And then they come in a year and a half and I'm still learning things. And then from a personal standpoint, just really advocating, I had elderly parents. And so all of us went months without seeing our family, but especially me. And honestly, my father wasn't too hip on me coming over anyway. And, he's very COVID conscious. My husband's very COVID conscious. And so all those things that we had to deal with. And then even just from an immunization standpoint, how do I get my family? I remember, how do I get my father the shot? Because he was shot, right? He wanted the shot and just but he doesn't have a my chart and all those things. And then still really from a community standpoint, reaching out to my community. And I will say I'm a shout out to Dr. Talonda Bragg, who was our own personal Dr. Fauci in our community, and took she still blames me for that, but I was and saying, hey, she carried, but we together, how do we get in our communities and promote masking and safety and immunizations? And so and we're still doing it. Today we're doing it. And so I think it really multifactorially impacted us. And we're continuing to still do it. How many people know what to do with the mask on Monday? If you're in healthcare, we know I gotta wear my mask. But if you have kids in school, mask, not wear masks, all those things. And then the mental health burden that I think Miss Robinson really talked about and highlighted. We're still seeing the ramifications of that. So we're hopeful, optimistically hopeful for 2022. Fingers crossed and prayer, hands prayed.
Yes, that was great. Like each of you shared like a different context, but what it does, it shows just how this COVID pandemic has impacted like every household, every individual, and it may have impacted each of us differently, but it has had a significant impact on us. So I appreciate the stories that you guys have shared, and I'm going to just kind of like ask each of you to just add a little bit more onto those stories. And so I'd like to start first with Mr. Moyer. And you talked about the resiliency that you've seen in like the hospital staff and just the community in general. Can you speak more on how healthcare institutions can strengthen the resilience in cities and communities to fight or withstand global pandemics, such as what we're currently facing?
Yes, so healthcare organizations can really continue to provide facts. So that factual data, that evidence-based data around things like COVID, around the different variants that we've experienced here, have been extremely helpful to communicate throughout. And if it's coming from the healthcare organizations, and especially a trusted healthcare organization, then you typically can have a better response rate to either masking up, to getting regular checkups, to getting your vaccinations. So that's one way. And then the other piece with the evidence-based practices. So Dr. Lowry kind of admitted to it, and she brought up Dr. Bragg, so she stole my thunder because I was going to talk about her as well. So I know for me, when I see and I hear the information from trusted clinicians, again, Dr. Lowry's on here, we talked about Dr. Candace Smith-King, who's been talking about it, Dr. Lipscomb from MSU, those individuals who are across the state who not only look like me, but are friends, who are colleagues, who are trusted. And I can go and tell and feel honest to talk to my family and say, hey, you all, if they are saying do this, then I think we should do this, because they are who care for us, who we go see. So that's one of the big things. And the other big thing is, I think, for resiliency is promoting preventative healthcare. So preventative measures such as regular health and wellness checks have been huge, to be able to have those done on a regular basis. I'm sorry, Sister Kenyatta talked about washing up and washing your hands. Don't just stop it now, because the numbers have gone down. Continue to do that. I think if we start to do preventative measures such as that, be mindful about still where we stand when we're talking with someone. I know we don't want to have that 6-foot distance in between us now, but if we start to get a little bit closer, just being mindful of that, and then still taking that time out. I think we were laughing about this last week, how when we were coming up, that 100% attendance for schools was a big thing. But now, if you've got kiddos who are feeling sick or coughing or aching, still keep them home so you can make sure you are regulating that and we can avoid the spread and preventing the spread. So those are some of the solutions that I think will help us be resilient. And then again, just not giving up on the fact that we want to be our best selves. So one of the biggest things that I would really advocate for, and I'm sure you're probably going to hear it today, is self-care. And self-care, both physically and mentally, that in and of itself can help us not only be more aware of how we're reacting, especially when we're going out in our day-to-day routines, but what we're doing when we either communicate or relate with families and friends and loved ones.
That's great. Thank you. Would any of the other panelists like to add to that? Okay, great. Well, thank you so much. Dr. Lowry, so the pandemic, I talk to people all the time and they talk about how the COVID pandemic has like amplified awareness about social and racial injustices in our communities. And so the question for you is when you look at like unconscious bias and how it impacts the African-American community, what ways do you feel the healthcare institutions can increase trust or restore trust within the African-American community?
You know, when I saw that question, I was like, really? Wow. You know, I think Mr. Moyer said it best, but we have to, one of the things is we're just really learning about the long history we have in the medical healthcare field. And if you want a very in-depth look at Harriet Washington's medical apartheid, and I made the mistake of reading it like right before the vaccine was coming out. But it really talks about, you know, we always talk about the Tuskegee experiment, but the hundreds of years, and not just in our African-American community. So I think as a healthcare institution overall, we have to own up to the hundreds of years of racism, classism, meritocracy, and injustice that we've had. With that said, though, I think we also have to own up how we're delivering it. And as much information we have to give, we also have to say, you know, we're kind of sometimes, I feel like even with COVID, I'm almost sometimes drinking from the fire hydrant because the information is coming at us so fast. And so how do we're able to digest that? But I really think it's having that relationships, those conversations, like Mr. Moyer said, you know, I have to, and meeting people where they are and the kind of understanding, you know, why I won't get the shot, why I'm feeling uncomfortable. I even talked to someone a couple of weeks ago and they were like, yeah, I'm really scared to kind of go back to the doctor to get that preventative health care. And I'm like, really? You know, but really had that I didn't answer that, but I was like, okay, these are the things I need to try to help you try to do. And so really, we have a long way to go. I think we have to own up to the like I said, hundreds of years, but really kind of regain those relationships. And it starts with having conversations and being engaged with our communities.
Great. Thank you, Dr. Lowry. And you mentioned Harriet Washington's book, American or Medical Apartheid. And I think that for me, when I hear people say, oh, you know, like we learned so much and COVID has really amplified our understanding and awareness. And, you know, historically, there's been so much that has, you know, like experimentation and harm that African-Americans have faced within healthcare systems. And so that in itself can create distrust when people are saying, well, we're just now like understanding or we're just now learning, but it is a starting place. And then, you know, and so then how do we capitalize on that starting place? And you know, one of the recommendations that I would make is for every healthcare provider to read Medical Apartheid, because I think that it goes so deep, and if they don't understand, if COVID helps them understand, medical apartheid would really help them understand. So I would like to get that in the hands of like every medical provider. So thank you for your response, and also for just sharing the information about that book, because it's incredibly powerful. But moving on to Ms. Robinson. So you like eloquently talked about like how COVID has impacted you. So as we look at our educational system and in the ways the schools have suffered, in the ways the children are falling behind academically, what support systems do you feel are needed to ensure students' safety and success? Not only like safety physically, but mentally and emotionally as well, in ways that can help and empower them to thrive and succeed.
Yeah, absolutely. When we talk about success with children, especially in school, there's only two words that come to mind to me that are mental health. Mental health is so important because mental health can affect your grades and your grades can affect your mental health. And I think it's so important that even just telling them it's okay to take a 5-minute break or to just ask your teacher, can I take a break for a second? Because it's very overwhelming. Sometimes we get into all this homework and we go on and on and on. And a lot of times we don't take that time to talk about our mental health. And then also if you're a parent, also sometimes the way that our grades are set up, when we're on a computer, it's not easy to learn because it's like they're just talking at us and we're not engaged in what we're supposed to be doing. So if you're a parent or even a friend, just ask the teacher or ask the school, what is my child or what is my friend or what is my niece, nephew learning? And then try to make it fun. Do a game.
I think we lost you. Looks like you're muted. So if you can unmute or if someone can unmute.
Can you hear me now? Yes. Oh, okay. I was just talking to their teachers and to their schools about what they should be learning and then making it fun and engaging so that they can actually process what they're learning so that their grades can improve.
Thank you so much. It's great. So moving on to Ms. Kenyatta Hill Hall, what do you think as a school principal, what are some of the greatest issues that you see facing students, teachers, and administrators? And how are safety policies implemented and monitored as it relates to like hand washing, using hand sanitizers? You talked about, you taught it in elementary school, but as you're looking at the ways that COVID requires us to take more precautions, and how do you manage that in the schools?
So I'm going to echo some of the panelists, but I'm going to start with our young little CEO there about how important mental health is. And so one of the key terms we talk about in the educational sphere is social emotional intelligence. Our students came back with some serious gaps from being in the silos of their home, from depression, anxiety, and so to what Mr. Moyer said, self-care is so important, starting off with admin, teachers, and students. And so it's really prevalent in the schools that is like our first thing that we are focused on. How do we help our students advocate, and how do we have systems in place for our kids? And so some ways that I can talk particularly about my school is that, in my district, is that there was a grant that we were able to get for therapists, in-house therapists for our students. I know sometimes for the African-American community, we are uncomfortable with talking about anxiety and depression, and thinking that of what self-care really means, but really having those authentic relationships that we have with family has been very powerful as kids are entering back full time around mental health and what that looks like. And that really using the system of our counselors and our therapists, because it's heavy for the teachers who are already feeling their own mental challenges, and then to continue to teach and take on students, and then also the administrator who's taking on the students and the teachers and the community, and it's a cycle. And so it's really about doing those things. So even we've added a mindfulness to the teachers and the parents first thing in the mornings, that they're welcome to come before we start the day, just trying to open up, because for our students, besides home, school is one of the second place that they spend so much time. So it's really important about educating about mental health. The next thing is continuing to still talk about safety aspect. As we have mandates have changed, we are still a district that students are wearing masks, having access for masks for our families that may not be able to financially. We have masks as soon as kids walk in the door. If parents ask for extra masks, we give them masks. To talk about still hand washing, how do we clean up, how to properly wear masks still. We're still talking about that. And then also giving an opportunity for students who may struggle with wearing masks all day long. That is still a challenge, from the little babies that are 5 all the way up to my 17, 18-year-olds, that having that mask on all day is where it's tiring. And then there's, other health underlying things that sometimes our families, our students deal with. So definitely the safety piece, and even how we have changed up our system. So, and then to what our kids always worry about is that we talk about what school is, academics. And at the end goal, graduating and getting on to that post-secondary. So that creates another whole thing of, there is some academic gaps that has happened during this pandemic. The instructional teaching from virtual wasn't best for everyone. It was what we had to do. It's some resilience that kids have learned, and students and staff. And there is some growth that our kids have become technology savvy, but there were still some gaps because that wasn't the best way for all students. So now it's teaching our kids to do school again. It's teaching staff to do school again. It's trying to engage our students in different ways. It's also breaking up some of the bad habits that kids have gotten over, having their phones on them all the time. So there's a lot of different avenues, but I think really talking about where we are, having that the advocacies, and we have had many great community partners in Grand Rapids that have come alongside Grand Rapids Public Schools, me as a leader, to help with that, because this really isn't work that we can do alone. So.
Wow, thank you, thank you. One word that I heard from each of you is that the experience has been stressful. But it's been stressful, and it's really created like some mental health issues that's very important for our community at large to understand and to effectively respond to. And some of the ways and solutions that you guys have communicated, I think are very helpful in ways that you guys have been able to navigate through some of these stressful terrains, and provide like the resources that the students, parents, teachers, administrators need. And I know that we're not completely like there. We haven't like figured out all the solutions, but I do admire the work that you guys have done, and how you have so intentionally worked to find those solutions to support the communities that you're serving. So thank you so much for what you're doing. The next question is for all panelists, and this question is also related to strategies and solutions that you feel are necessary to decrease the COVID impact on our community. So what strategy solutions do you feel are necessary to decrease the impact of COVID, and how do you feel we can build greater confidence in the vaccine? I know that, I can just be walking, and, we are running vaccine clinics through the Grand Rapids African American Health Institute. And so we're out canvassing and talking, and some of the things that we hear, just about the hesitancy of the vaccine are really real and complex, and it can make it real complicated. But do you have any like things that you've done in the areas that you're working in that you felt has been impactful and helpful?
I don't mind starting. I would say, and two of the panelists said this, authentic relationships, to take away the fear fact or debunking some of the information that has come out, because like Dr. Laurie said, it was a hydrant of things, and it was all ever changing. You were like, is this fact, is this not, and so really when you have authentic relationship and people who are connected to the work, that helps to build trust about navigating. And I feel like as the leader, instructional leader at my school, that's what we try to do for our students, not to necessarily push them to away, but just giving them correct information. Our kids are in a world of social media, in particular TikTok, and TikTok has lots of good, fun information and lots of misinformation. But to them, that is the Bible. That is their Bible. That's what they live by. And so really telling the students that what research is based behind that. What do you know? Like, why trust this source? And so having those relationships with the students and the families, and then being transparent about my own journey and why I did make the choice and why my family has made the choice. And so those are different ways. And so even with our internship group that was in the health industry, we had them do a TikTok about the facts that if that's where kids are getting the information, don't go against it. Let's be a part of it and let's really educate. So that would be my suggestion.
Great. Well, CEO Robinson, you've earned a new title here today. So would you like to respond to the question?
Yes, I think that what she said was absolutely right. What Ms. Hall said was absolutely right. And I think that transparency and open dialogue is great. And just sharing your experiences and why you did it and why others did it is absolutely a great thing to do.
Thank you. Dr. Lowry?
Yeah, I agree. I mean, the pessimist in me says we've probably hit the greatest threshold of people that are going to get it. If you're going to get it, you've already gotten it. We might see another 1 to 5%. But again, that's another 1 to 5%. So as the pediatrician, and we always go say every opportunity to immunize. And so every opportunity to immunize, every opportunity to have the conversation. And also I found out having the conversation in line with other vaccines, because what we did see is that people weren't going to their doctor's office, so they weren't getting other vaccinations, and then they were like, well, they were lumping all immunizations in. But also I'm really having the conversation. So every time, why aren't you getting it? And then go, okay, yep. I don't know what it's going to look like 5 to 6 years from now. I don't know this. We don't know this. However, but I can tell you this. So really having those and really realizing that people, what I feel, they're entering into this conversation with their own risk-benefit analysis. That's where and at some point, that's what you have to deal with. Now I'm willing to, if they come out with me with some misinformation, I'll be like, no, that ain't gonna happen. And I'm very honest, but I really realize that just having that conversation, and it really is a conversation, and it's a conversation to understand, not always a conversation to persuade.
Right.
So
thank you.
And I guess I need to get a TikTok video. I didn't know I needed to get a TikTok video. So I guess I have to go call up CEO Robinson and get a TikTok video, because that's the one thing we haven't talked about in our Black Vax campaign, I don't think.
She can be the youth spokesperson.
I'll help.
You want to be the youth spokesperson, so you may be getting a call from me. Mr. Moyer, would you like to add to this question?
Absolutely. CEO Robinson, I love the fact that she is where she is, because I think we take for granted the voice of the youth.
Absolutely.
And she has, in your age group, your circle, have a huge influence on a lot of people. And I didn't realize that until I looked at my teenagers when they got vaccinated, and my in-laws and my parents who were somewhat hesitant at first. And this is a generation that was the generation that endured the Tuskegee experience, and they saw all of it, and the mistrust is really high there. But when they looked at the youth, when they looked at their legacy going in to be vaccinated, it was eye-opening. And I still to this day, so my in-laws were very hesitant in getting the vaccinations. And I don't think it was actually until my 8-year-old walked up to them and said, "Hey, grandma and granddad, I just got my vaccination and my flu shot at the exact same time. When are you going to get yours?" And it just, like, you could see their face change. everything changed. And just hearing him talk, using his voice. I have a mentor, and one of the things that he always says is, his name is Ovell Barber. He always says, use your voice and people will listen. And he did just that. He just asked a simple question. He made a statement, asked a simple question, and it changed the world for them. So I would definitely say, keep talking about it. Again, to Dr. Lowry's point, you don't necessarily have to kind of convince them or try to persuade them. You can actually just listen and then share your own experience, share your story, because it can be helpful.
That's great. Your son was interviewed by TV8, and I remember him quoting that adults just need to be more responsible. So he's definitely using his voice. So kudos to him for the influence that he has. So we're going to move on to next question, and this one I'll ask you, Mr. Moria, as well as Dr. Lowry. What can we do to make vaccinations available to those who just may not have transportation or mobile units to be able to get have access to COVID clinics? So have you had any situations with that, and how do you see the systems supporting people who don't have access to transportation or some of the technology resources that information are usually conveyed through?
Absolutely. So my biggest message that I always talk about, especially working in the community, is meeting people where they are. So go to people. We don't necessarily have to have, I know we have all these wonderful, great facilities that are around here, but take it to where people are. Go into the urban setting, set up the pop-up clinics. So a huge plug for Grand Rapids African American Health Institute for being able to set up their vaccination clinics in Brown Hutchinson Ministries. We've had them at New Hope, and so grateful for the work they've done there. Cesar Chavez at the schools when we were setting up those clinics, and partnering with great organizations like Cherry Health, and the Black Nurses Association, who are not only just establishing mobile units, but they're going in homes. The Black Nurses Association, you place a call and they will come to you for not just the first vaccination, the second and the booster. They will do all three at the same time. So I think that in and of itself is one of the biggest things, but then also partnering with organizations like Uber and Lyft, the rideshare organizations, our cab companies, and being there to offer rides for anybody who needs to get one if they don't have that transportation. And one of the biggest things that we've actually seen is actually going to places where our people frequent. So go to the barbershop, set up the clinics at the barbershops and the beauty salons, go to the grocery stores, be out where the people are, where we reside, and you can catch them. And I know that there have been a ton of organizations that have been doing great work, and we just need to keep it up. Again, to Dr. Larry's point, I know that we'll start to see it dwindle down, but I'm going to be honest with you, I don't think that COVID is going away anytime soon. This is going to be around for quite some time. We're going to need boosters. We're going to need vaccinations. So continuing to encourage those boosters and vaccinations and make it accessible to everyone, not just the people who come into offices, but make it accessible to everyone.
Great. Thank you so much. And as you mentioned, there are clinics that's going to be like every place in King County. Well, not every place, but there are clinics that are in locations that will make it accessible for people to get vaccinated. And I think that, as we talk about like trusted communities and trust equity, I think that each person has like a different sector that we build that trust equity within. And so it's not like one group or one organization, but it requires all of us working together within, our spheres of influence, and certainly not arguing or, trying to persuade, but modeling and loving them, through some of the, misinformation that they may be receiving that's impacting some of their decisions. So, but thank you for that. And Dr. Lowry, do you have anything to add to that?
No, that was perfect. I have nothing to add. That was great.
So thank you. The next question is directed to Ms. Kenyatta Hill Hall and CEO Robinson. So what words of advice would you give to people who are still hesitant about the vaccine?
I mean, Mr. Moyer really captured everything, but really just, I would say, and because of the group who I serve, my middle and high school, they can't always make health decisions for themselves. And so they may want to, but there may be resistance or uncomfortability with parents. And so continuing to walk alongside the students and the families, and to continue to, like it was said earlier, to listen and to educate, but lovingly respect. But just like when my students hit that graduation and they're able to make decisions, I say, you are the young adult now, you are making the decision. So helping them to navigate access to different things. So whether that is, how do I get vaccinated? Now I get to make my own choices for myself. It's the same way that as soon as our kids hit 18, we talk about getting them set up to vote so that they have a voice. There's ways to empower our babies so that they have the knowledge that when they do make the decision for themselves, they have the knowledge to do that, to empower and advocate for themselves. So.
Okay, thank you. Ms. Robinson, would you like to add to that?
I have nothing to add. I think everyone, I think everyone said what they just took the words out of my mouth. I have nothing to add.
See what happens, Mr. Moyer, when you are so good? No, that's great. Thank you, guys. So last question for each of you then. What words of advice would you give to the audience about things that they can do to stay safe in exercise? And we've talked about the, washing your hands, continuing to wear masks, social distancing. Do you see anything else that they could do or that you'd recommend?
I know for me and my family, we do a routine when we get home. When we get home, we take our shoes off at the door, change our clothes, put them in the laundry room, wash our hands right after we get home, so that if you don't feel safe anywhere, you should feel safe at home.
That's great.
And I know for me, it's yes and so, one of the things I know we really politicized the vaccine, a virus, and masks. And so for me, actually, it's not for me just COVID. I don't want to get sick from other stuff, the flu. We have, my staff is sick with non-COVID stuff. We had the gastrovirus going through our office. So those are the other things. So, if we go back to there was a sign that I saw several months ago that was based on the 1918 flu, and it had wash your hands, cover your face, all those things. Those are just the simple things we need to do that have been around for hundreds of years. And so wherever you stand with the vaccine, again, that's your cost of risk benefit. If you get then get the vaccine. If you feel like, wear a mask. I'm still very uncomfortable not wearing a mask in Myers. That's my personal choice. And so, but I also don't want to get the other viruses that we've actually kind of forgot about. And so those are the things, and try not to be fatigued. Go back to your doctor for your health care. I know we're still catching up, but make those appointments for those mammograms, those pap smears, those prostate exams, all those colonoscopies, all those, or just your regular, hey, how you doing check. And then the other thing that it's not lost on me is this mental health component. We are weary, we are tired. And a colleague of mine, we were just sitting and talking, we were a little slow yesterday afternoon, and we were just sitting there chatting and catching up and just sharing, like, we're tired and we don't know why, and all these things, and just giving yourself, reach out and get some help. You have those health benefits. If you don't have health benefits, we have Network 180. We have a slew of healthcare providers, mental health care providers of color, or things like, reach out. The one thing I am going to tell people is, and this is the kind of, well, I called and they didn't call me back. My rule of thumb is call about 6 or 7 people, because they're all very busy. And so those are the things. And then we have to take time for ourselves. And I'm going to laugh. Our principal, Hill Hall, we were at an event about 3 weeks ago, and we were talking about taking that time for ourselves, reconnecting with our families, our spouses, all those things. And CEO Robinson said, you know, we done got on each other's nerves. It was fun at first, and now we getting on each other's nerves, but reconnecting with our family, mindfulness, prayer, whatever those things are. And those are the things I think we have to do, because otherwise we get, like, we know that people are getting pandemic weary, but our guard still needs to be up.
Yeah, well, thank you so much. And this is Black History Month, and I can't even think of a better type program to have in celebration of Black History Month than talking about the health and wellness of our community, not only as it relates to COVID, but as it relates to mental health and our health in general. So thank you, Dr. Lowry, for bringing up like some of the other health issues that our community is experiencing. And I can tell you that, you know, as you are considering, you know, the risk factors of being vaccinated versus not being vaccinated, that the African-American community is 14% population, but we are dying at a rate of 40% from this virus. And much of it is not that we are contracting the virus more than other racial ethnic groups, but because we carry so many other comorbidities, and many of them are influenced by our mental health, that causes, you know, like things like stroke and heart attack and high blood pressure and those kinds of things. And so when we're carrying all those other like comorbidities, when we get COVID or we catch any type of virus or illness, and it typically will impact us more in our outcomes. The disparities in our outcomes will be greater, which is why, you know, on some level, like people are tired of being like encouraged to talking about, you know, COVID and the vaccine, but it is a matter of life and death. And we care so much that we want to have every opportunity possible to make sure that the community is aware of the risks that are playing out in our community. And so we don't mean to be bugging people, but this is really, these are acts of care and compassion and concern for the community. So I would just like to close out, and then we will have like closing remarks also from our president, Mia Guthridge. But I just want to thank, everybody out in the technology of, the virtual land for joining in today and sharing this Black History Month program with us. And as we continue to celebrate Black History Month and navigate the uncertainties of the pandemic, I would like to leave you with these words found in Philippians 4:6-8, one of my favorite scriptures in the Bible, which talks about or says, "Be anxious for nothing, but in everything by prayer and supplication, with thanksgiving, let your requests be made known to God, and the peace of God, which surpasses all understanding, will guard your hearts and minds through Jesus Christ. Finally, brethren, whatever things are true, whatever things are noble, whatever things are just, whatever things are pure, and whatever things are lovely, whatever things are of good report, if there is any virtue, and if there is anything praiseworthy, meditate on these things." And one of the common themes in today's conversation was the need for self-care and mental health. And I think that this scripture is very befitting. Meditate on things that brings you like peace, calmness, and joy. And with that, thanks again to our esteemed panelists, to the audience. And now I will turn it over to our wonderful dynamic president, Mia Guthridge. Well, at this time, I am unable to start my video, but you can hear my voice. And I just want to thank the panelists. This was awesome. What a better way for Black History Month to talk about how COVID has impacted our community. It impacted us differently. And thank you to Dr. Lowry. Thank you to Brother Moyer. Thank you to CEO Robinson. Thank you to Principal Hill Hall. And thank you to our moderator, Green. You all kept the conversation so engaging, so enlightening that, Brother Lee talked about the preventive measures, washing your hands, don't forget those annual checkups, wear your mask, stay home when you're sick. We want to be our best self. So in order to be our best self, as our panelists stated, we have to take care of ourselves. Dr. Brotherly also talked about the importance of self-care. And then, Dr. Laurie came in and talked about ownership. Everyone plays a part in this. So everyone has to own their piece of the puzzle, whether it's the racism in the healthcare or whether it's educating ourselves so we can have the information to make the best decisions for us and our families. That book, please go out and get it. Medical Apartheid. I'm gonna get it. I'm not even in the medical field, but I want to know just from by this conversation what's in that book. So CEO Robinson talked about mental health. And yes, one of the panelists stated that in the Black community, there's a saying that goes, what goes on in this house stays in this house. So, we have been trained and programmed not to tell our business. Well, guess what, y'all? Throw that away. Tell your business, get some help. We need help. And nothing that COVID taught us was we need help. Go tell your business to a trusted person, not to your friend, but to a medical licensed person that can give you the tools and the guidance that you need to get help. But then CEO Robinson also stated, when the students had to go home, learning from a computer is different. There's no engagement. They lost their social engagement. She then say, parents, make it fun. Talk to the teachers. Ask them, what are they learning? Okay, let me go get some chopsticks or some drums and say, okay, 2 + 2 is 3. Ha ha. Make it fun for them. In the process, they need this. They really need this. Okay, then Principal Hall talked about social and emotional intelligence. Not only were the students affected, the administrators and the teachers were affected. They have had a hard time even before COVID happened, but just when COVID happened, they had to make a shift because they now had to teach via a television, via technology. They had to find ways to make it interesting for the students to stay on the computer for 4 or 5 hours in the day, as well as look at the engagement and the retaining of the information. And I like that when you talked about the in-house therapists, teachers, administrators, students, use it. Tell your business. Don't be shy about it. Take that 5 minutes and say, look, I just need to go talk to somebody. Sometimes when you release it, you feel good, even if you don't want them to tell you anything. I just need for you to sit down and listen. I'm gonna tell you all my business, and then I'm gonna go about my business, right? But community, this is what, if you have not taken anything away from this talk, take this. Educate, educate, educate yourselves, educate those around you, use your voice, wear your mask properly, wash your hands, get your checkups, and be transparent about why you made the decision or not made the decision to get vaccinated. Community, I love you all for taking the time out of your day to listen to the Shades of Blackness, how COVID impacted our community. Have a good evening.
All right. Sorry for that long, awkward pause, but it wasn't awkward on Facebook.
You guys were
On-
Great
On
discussion,
behalf-
everybody.
Yes,
Good
on
job,
behalf
you all.
of
That was
the
wonderful.
International Awareness Committee, I cannot say thank you enough to everyone. This was absolutely awesome. And what a great way to kick off and to discuss during Black History Month. So I greatly appreciate each and every one of you for taking the time out of your day today.